Hi viewers, welcome to my YouTube channel. Today we will discuss about the symptoms, causes and treatments for hypertension. High blood pressure is a common condition that affects the body's arteries. It is also called hypertension. If you have high blood pressure, the force of the blood pushing against the artery walls is consistently too high. The heart has to work harder to pump blood. Blood pressure is measured in millimeters of mercury. In general, hypertension is a blood pressure reading of 130 by 80 mm mercury or higher. The American College of Cardiology and the American Heart Association divide blood pressure into 4 general categories. Ideal blood pressure is categorized as normal. Normal blood pressure. Blood pressure is 120 by 80 mm mercury or lower. Elevated blood pressure, the top number ranges from 120 to 129 mm mercury and the bottom number is below, not above, 80 mm mercury. Stage 1 hypertension, the top number ranges from 130 to 139 mm mercury or the bottom number is between 80 and 89 mm mercury. Stage 2 hypertension, the top number is 140 mm mercury or higher or the bottom number is 90 mm mercury or higher. Blood pressure higher than 180 by 120 mm mercury is considered a hypertensive emergency or crisis. Seek emergency medical help for anyone with these blood pressure numbers. Untreated high blood pressure increases the risk of heart attack, stroke and other serious health problems. Symptoms. Most people with high blood pressure have no symptoms, even if blood pressure readings reach dangerously high levels. You can have high blood pressure for years without any symptoms. A few people with high blood pressure may have headaches, shortness of breath, nosebleeds. However, these symptoms are not specific. They usually don't occur until high blood pressure has reached a severe or life-threatening stage. When to see a doctor? Blood pressure screening is an important part of general health care. How often you should get your blood pressure checked depends on your age and overall health. Ask your provider for a blood pressure reading at least every 2 years, starting at age 18. If you are age 40 or older, or you are 18 to 39 with a high risk of high blood pressure, ask for a blood pressure check every year. Your care provider will likely recommend more frequent readings if you have high blood pressure or other risk factors for heart disease. Children aged 3 or older may have blood pressure measured as a part of their yearly checkups. If you don't regularly see a care provider, you may be able to get a free blood pressure screening at healthcare resource fair or other locations in your community. Free blood pressure machines are also available in some stores and pharmacy. Ask your health care provider for advice on using public blood pressure machines. Causes. Blood pressure is determined by 2 things: the amount of blood the heart pumps and how hard it is for the blood to move through the arteries. The more blood the heart pumps and the narrower the arteries, the higher the blood pressure. Risk factors. High blood pressure has many risks including age, like women are more likely to develop high blood pressure after age 65 and men after age 64. Race. High blood pressure is particularly common among black people. Family history, obesity or being overweight. Lack of exercise, tobacco use or vaping. Too much salt, low potassium levels, drinking too much alcohol. Stress, certain chronic conditions, pregnancy. So all these are the points about symptoms, causes and treatments for hypertension. I hope you like my video. Please subscribe my channel. Thank you.